Oral contraceptive. Oral contraceptive is a pill used to prevent pregnancy. It contains hormones that block the release of eggs from the ovaries. Most oral contraceptives include estrogen and progestin, also called birth control pill. To use oral contraceptive, the standard way to take the oral contraceptive pill is to take one every day for 21 days, then have a break for 7 days, and during this week you have a bleed like a period. You start taking the pill again after 7 days. The advantage of using oral contraceptives. Some advantage of the pill is include it does not interrupt sex. Usually makes your bleeds regular, lighter and less painful. It reduces your risk of cancer of the ovaries, womb and colon. Disadvantage. Some disadvantage of the pill include it can cause temporary side effects at first, such as headache, nausea, breast tenderness, and mood swing. If these do not go after a few months, it may help to change to a different pill. It can increase your blood pressure. The side effects of oral contraceptive. Number 1. Nausea, vomiting, stomach cramps or bloating, diarrhea, constipation, headache, breast tenderness, and mood swing. Transdermal patch. Transdermal patch adhere to the skin as a way to deliver drug. They provide a specific predetermined dose of medication that is absorbed through the skin and into the bloodstream. Tips to use patch transdermal. Place the patch carefully. When placing a patch, choose a spot where that patch will attach well. Follow the instructions. Rotate location. Don't overlap patch. Take care of loose patch. Don't suck the patch. Store patches carefully. Avoid hitting pads. Advantage of using transdermal patch. Transdermal delivery offers several benefits over oral delivery, including smooth, continuous drug delivery, increased bioavailability, and reduced drug interactions. Patches can be easily applied by the caregiver and they provide a usually cue that the medication has been administered. Disadvantage of using transdermal patch. The patch is not a perfect means of contraception because of some drawbacks listed below. It does not provide protection against sexually transmitted infection or STIs, including HIV. Must be prescribed by a healthcare provider. The estrogen levels are higher with the patch than with other hormonal methods. The side effect of using transdermal patch. Difficulty falling asleep or staying asleep. Headache. Dry mouth. Stomach pain. Skin irritation. Itching, swelling, or redness in the area when you wear the patch. Vaginal ring. The vaginal ring is a small soft plastic ring that you place inside your vagina. It releases a continuous dose of the hormones estrogen and progestogen into the bloodstream to prevent pregnancy. To use a vaginal ring, you squeeze the ring and insert it into your vagina, like inserting a tampon. It stays in your vagina for 3 weeks. You take You then take it out and throw it away and wait 7 days before inserting a new ring. Advantage And disadvantage of using vaginal ring. It doesn't interrupt sex. It is to put in and take out. You don't have to think about it every day or each time you have sex. The ring isn't effective if you're sick or have diarrhea. It may help with premenstrual symptoms. The side effect of using vaginal ring. It may cause temporary side effects such as increased vaginal discharge, headache, nausea, breast tenderness, and mood change. Subdermal contraceptive. Subdermal contraceptive implants involve the delivery of a steroid progestin from polymer capsules or rods placed under the skin. The hormone diffuses out slowly at a stable rate, providing contraceptive effectiveness for 1 to 5 years. The period of protection depends upon the specific progestin and the type of polymer to use of subdermal contraceptive. The contraceptive implant is inserted beneath the skin of the upper arm. The implant releases a progesterone hormone to prevent sperm from reaching the egg. The implant typically suppresses ovulation as well. You can have a contraceptive implant inserted during a visit to your healthcare provider's office. Advantage of using subdermal contraceptive implants, including long-term contraceptive action without requiring the user's or provider's attention. Low dose of highly effective contraception without the use of estrogen and fertility in readily reversible after the removal of implants. Disadvantage of using subdermal contraceptive. You may experience temporary side effects during the first few months like headache, nausea, breast tenderness, and mood swing. Your period may be irregular or stop altogether. You may get acne or your acne may get worse. The side effect of using subdermal contraceptives. Abdominal or back pain. An increased risk of non-cancerous ovarian cysts. Change in vaginal bleeding patterns, including absence of menstruation. Decreased sex drive. Dizziness. Headache. Mild insulin resistance. Mood swing and depression. Hormonal injection. The hormonal injection is a shot that contains hormones, either progestin alone or progestin and estrogen together, that stop your body from releasing egg and thickness the mucus at the cervix. To use hormonal injection, it is given as an intramuscular injection into the buttock or the upper arm, and over the next 12 weeks, the DMPE is slowly released into the bloodstream. To prevent pregnancy, an injection must be given every 12 weeks. The advantage and disadvantage of the hormonal injection. Each injection lasts to either 8 or 13 weeks. It does not interrupt sex. It's also option. You can use estrogen-based contraception. You do not have to remember to take a pill every day. It's safe to use while you're breastfeeding. It's not affected by other medicines. The side effects of using hormonal injection can include weight gain, headache, mood swing, breast tenderness, and irregular bleeding. Your periods may become more irregular, higher, shorter, lighter, or stop altogether. Chemical barrier. Chemical barrier destroy pathogens on the outer body surface of the body opening and inner body linings. Sweat, mucus, tear, and saliva all contains enzymes that kill pathogens. To use the chemical barrier methods, this stop the sperm from reaching the egg. Types of barrier method include condoms, diaphragms, cervical caps, and the contraceptive sponge. Barrier methods work better when you use them with a spermicide. Advantage of using chemical barrier. Condoms protect against pregnancy. Barrier methods are safe to use for breastfeeding. Barrier methods do not use hormones. This method do not affect a woman's menstrual cycle. Barrier method cause less hormonal types of birth control. Disadvantage of using barrier method. This method do not prevent pregnancy as well as IUDs or hormonal forms of birth control. Barrier methods prevent pregnancy only if you use them every time you have sex. You may have to interrupt sex to use some barrier methods of birth control. Side effect of using chemical barrier. It can cause vaginal burning and irritation from the spermicide. Some people are allergic to spermicide or latex and may have a reaction. Use a diaphragm, diaphragm and spermicide may increase this risk of urinary tract infection. Cervical cup. A cervical cup is a small cup made of silicone that fits over the cervix, the part of the uterus that opens into the vagina. It covers the cervix so sperm can get in and fertilize an egg. How does a cervical cup work? The cervical cup keeps sperm from entering the uterus by covering the cervix for added protection. Spermicide is put into the cup before inserting the cup snugly over the cervix. The cup can be put in several hours before having sex and must be left in at least 6 hours after sex. Advantage of using cervical cup is unlike a diaphragm. The cervical cup protects against pregnancy from 2 days or 48 hours and for multiple acts if it occurs within the time frame. When placed appropriately, the cervical cup is often not felt by either partner during sexual intercourse. Disadvantage of using cervical cup. This cervical cup is more difficult for women to learn to insert and remove than the diaphragm. If worn for more than 2 days, you run the risk of toxic shock syndrome or unpleasant vaginal odor and discharge, mild allergic reaction to silicone or spermicide. The possible side effect of using cervical cup may include from the spermicide, irritation on the vagina and surrounding skin or an allergic reaction, strong odors or vaginal discharge if the cup is left in too long, an allergic reaction to the material in the cup, change in the cervix because of irritation. Male condoms. Condoms are various methods of contraception. They are made of very thin latex or rubber, polyurethane or polyisoprene and are designed to prevent pregnancy by stopping sperm from meeting an egg. They can also protect against STIs if used correctly during vaginal, anal, or oral sex. To use male condoms, unroll condom all the way down the penis after sex, but before pulling out, hold the condoms at the base. When Then pull out while holding the condoms in place. Carefully remove the condoms and throw it in the trash. Advantage of using male condoms. When used correctly and consistently, they are a reliable method of preventing pregnancy and protecting both partners from STIs, including chlamydia, gonorrhea, and HIV. Disadvantage of using male condoms. Some people are embarrassed to use condoms or feel they may interrupt foreplay or intercourse. Both partners must be comfortable with using a condoms and be prepared to use one every time they have sex. Condoms may decrease sexual sensation. Some people are allergic to latex. Condoms may break or leak. Condoms have no side effect. Most people can use condoms with no problem. There are no side effects. Rarely latex condoms can cause irritation for people with latex allergy or sensitivities. Female condoms. Female condoms are made from soft, thin, synthetic latex or rubber. They're worn inside the vagina to prevent semen getting to the womb. To use female condom, find a comfortable position while holding outside of condom at closed end, waist side and inner ring together with your thumb and forefinger and insert into vagina. It is similar to increase a tampon using your finger. Push in the ring as far up as it will go until it rests against cervix. Advantage of using female condom. Female condoms help to protect both partners from STIs including HIV. When used correctly, they reliable method of preventing pregnancy. It is a form of contraception you only need to use when you have sex. There are no serious side effects. Disadvantage of female condoms. They can slip out of place during sex. They can irritate your or your partner's skin. This might make a sensation of sex less. They're slightly less effective at preventing pregnancy and STDs than male condoms. There is no side effect of using condoms. Abstinence. This means avoiding all types of intimate genital contact. Someone practicing complete abstinence does not have any type of intimate sexual contact, including oral sex. To use abstinence, for most people, abstinence means not having sex with anyone. Sometimes people use abstinence as a birth control to prevent pregnancy. Abstinence prevents pregnancy by keeping semen away from the vagina, so that sperm cells in semen can get to an egg and cause pregnancy. Advantage of abstinence. Abstinence can be a way to avoid the risks that come with sex, like pregnancy and STD, until you are ready to prevent and handle them. Abstinence can also help you focus on other things in your life that are important to you, like friends, school, sports, activities, having fun, and planning for your future. Disadvantage of abstinence. Experience show that even people committed abstinence may unexpectedly have sex and may not be prepared to protect themselves from pregnancy and STI. Many people may find it difficult to maintain abstinence over the long term. Side effects of abstinence: anxiety and stress, memory, relationship health, immune system, vaginal walls and lubrication, prostate cancer. Calendar method. Overview: the Redham method, also called the calendar method or the calendar Redham method, is a form of natural family planning. To use the method, you track your menstrual history to predict when you ovulate. This help you determine when you are most likely to conceive. To use calendar method, record the date of 6 to 12 of your menstruation cycles. Determine the length of your shortest cycle. Determine the length of your longest menstrual cycle. Plan 6 carefully during fertile days. Update your calculations every month. Advantage of calendar method. The calendar method helps you predict your fertile days by tracking the length of your menstrual cycle over several methods. Disadvantage of calendar method. The biggest drawback is that it's not as effective of preventing pregnancy as other birth control methods. It requires you to be diligent in tracking the record your cycle, and even then it can be hard to be 100% sure that when days you're fertile. Side effect of calendar method. There are no physical side effects and you can use it to plan when you get pregnant. You have to keep a daily record of your fertility signals. Quietus interruptus. Quietus interruptus, also known as withdrawal, it is the traditional family planning method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculation. To use quietus interruptus, also known as withdrawal, it is a traditional family planning method in which man completely removes his penis from the vagina. Advantage of Quietus interruptus. Some benefits of Quietus interruptus are the method is used correctly does not affect breastfeeding and is also available for regular use or use a backup method. In addition, Quietus interruptus involves no economic cost or use chemical and has no directly associated health risks. Disadvantage of Quietus interruptus. Aside from this risk of not withdrawing in time, the other major disadvantage regards Quietus interruptus as a contraceptive involves the pre-ejaculation pill that appears after the penis becomes erect. A few drops of semen contained sperm may be deposited into the vagina without the knowledge of either partner. Side effect of Quietus interruptus. Ways using the withdrawal method to prevent pregnancy pose any direct risk, but it doesn't offer protection from sexually transmitted infections. Some couples are felt that the withdrawal method disturbs sexual pleasure. Basal body temperature. Your basal body temperature is your temperature when you are fully at rest. Ovulation may cause a slight increase in basal body temperature. You'll be the most fertile during the 2 to 3 days before your temperature rises. By tracking your basal body temperature each day, you may be able to predict when you ovulate. How to use basal body temperature. Take your basal body temperature every morning before getting out of bed. Use a digital oral thermometer or one specifically designed to measure basal body temperature. Or 2. Track your temperature readings. Plan sex carefully during fertile days. Advantage of basal body temperature. Basal body temperature can be used as a way to protect fertility or as part of a method of contraception by helping you get the best day to have or avoid unprotected sex. Tracking your basal body temperature for either fertility or contraception is inexpensive and doesn't have any side effects. Disadvantage of basal body temperature. What are the hardbacks of the basal temperature method? The basal body temperature method may not accurately predict ovulation in all women, including those with irregular menstrual cycle. It offers no protection from sexually transmitted. Side effect: basal temperature. Tracking your basal body temperature for either fertility or contraception is inexpensive and doesn't have any side effect. Some women may choose to use a basal body temperature method for religious reasons. The basal body temperature method can be also used to detect pregnancy. Symptothermal method. Symptothermal method, a fertility awareness method used to predict when a woman may be fertile. The method uses body temperature and other signs and symptoms of ovulation. To use symptothermal method, number 1. The temperature method. You take your temperature in the morning every day before you get out of bed. The cervical mucus method. You check your cervical mucus vaginal degrees every day. The calendar method. You can chart your advantage cycle on a calendar. Advantage of symptothermal method. The symptothermal method has a significant advantage in effectiveness because of combine the calendar method, cervical mucus, and temperature methods. However, this technique shares the same disadvantage that each of these techniques has individually. Disadvantage of symptothermal method. Disadvantage of the method are that intercourse must be restricted to only 7 to 13 days of the cycle. Women must take their temperature daily. The method cannot be used during fever episodes, and the method is inappropriate for use during lactation or near menopause. Side effect of symptothermal method. Both these methods are accused with side effect, particularly in combination with other medication and tobacco, and health complications including mood change, acne, headache, breast tenderness, pelvic pain, excessive bleeding, amenorrhea, nausea, weight gain, and uncommonly blood clots. Cervical mucus method, also called the Billings evolution method. The cervical mucus method is based on careful observation of mucus partners during your menstrual cycle. Before ovulation, cervical secretion changes, creating an environment that helps sperm travel through the cervix, uterus, and fallopian tube to the eggs. To use mucus method, to use this method, record your cervical secretion for several cycles, starting the day after your menstrual bleeding stops. Observe and record your cervical secretions on a daily chart, either on a paper or an app designed to track fertility signs. Advantage of cervical mucus method. The cervical mucus method is a way to identify fertile times to help you genuine the best days to have avoid unprotected sex. Tracing your cervical mucus for either fertility or contraception is inexpensive and doesn't have any side effect. Some women choose to use the cervical mucus method for religious reasons. Disadvantage of cervical mucus method. The major drawback of the cervical mucus method is that it doesn't protect against sexually transmitted disease. Other disadvantage is that this method causes a higher risk for unintended pregnancy than other birth control methods. Side effect of cervical mucus method. The cervical mucus method is a way to identify fertile this to help you gain the best date have or avoid unprotected sex. Tracking your cervical mucus for either fertility or contraception is inexpensive and doesn't have any side effects. Some women choose to use the cervical mucus method for religious reasons. The surgical method. The surgical method have two types: open surgery and minimally invasive surgery. Open surgery. An open surgery means the cutting of skin and tissues so that the surgeon has a full view of the structures or organs involved. Minimally invasive surgery is any techniques involved in surgery that does not require a large incisions. Advantage of using surgical methods: prevent or prevent a medical condition caused by a patient or discipline. Source in energy, increase life expectancy, increase self-esteem, weight loss, better sleep. Some of the disadvantages of surgical method include the following. It is requires surgery usually under a general anesthetic. There is a risk, albeit low, of surgical complications such as internal bleeding, infection, or damage to other organs. Side effects after surgery: pain. During and right after surgery, a surgeon typically works with a anesthesiologist to manage pain using medication to block the awareness of pain called anesthesia. Fatigue, appeal loss, problem with the parts of your body, swelling, drainage, infection, or bruising. Ovulation detection. An ovulation home test is used by women. It helps determine the time in the menstrual cycle when getting pregnant is most likely. The test detects is a risk and luteinizing hormone LH in the urine. A risk in this hormone signals our ovary to release the egg. To use ovulation detection, it is essentially all you all have to do is pay it on a stick or strip and wait a few minutes for the indicator to appear. The test line shows up darker than the control line. You're able to evaluate. Advantage of ovulation detection. This test checks the level of this hormone by detecting a surge in LH. It helps predict when you will evaluate. Knowing this information helps you and your partner time sex for pregnancy. Disadvantage of ovulation detection. Disadvantage include limited detection. Ovulation tests detect LH level but they don't give you an exact date of ovulation. Eggs may not emerge even after the LH surge. Side effect of ovulation detection. Your cervical mucus. You may notice whether clear and more slippery mucus around the time of ovulation or body. Temperature. There is a small risk body temperature after ovulation takes place, which you may be able to detect with a thermometer.